Assalamualaikum. On behalf of Rotary International South Lahore and Phoenix Foundation of Research and Development, I welcome Dr. Erwin on this webinar. The topic of today's webinar is role of herbal supplements in boosting immunity. Mr. Erwin is a PhD in pharmacy. He is a member of Malaysian Pharmacy Society and fellow of Royal Institute Pharmacist Singapore. He is a member of a faculty of St. Pedro College, Philippines, and he is a very renowned person, very good person. He is a very vast experience of his sharing his knowledge. Welcome, Mr. Erwin. How are you?
Thank you very much.
You
I'm
know,
okay. I'm fine.
okay, fine. We are going to start with the session with our verses from Quran, then national anthem from Pakistan and Philippines. Then we will start the regular session. We are going to do the national anthem of Pakistan, then the national anthem of Republic of Philippines. First, we have a national anthem of Pakistan. No, we have a national anthem of Philippines. Thank you. How was Alban national anthem Pakistan and Philippines? What are your feelings, emotions?
It is a patriotism and nationalism that we have as a Filipino, as a Pakistani, with our country. I
Mhm.
think that's the legacy of our previous ancestors that we have.
Ancestors, yes, you're right. Now, come to the topic. Today's topic is a role of herbal supplements in immunity. So it is up to you. Ball is on your court. Start your lecture or presentation. What have you prepared for this?
Okay, thank you very much. I'm going to share my PowerPoint slides with regards to the topic on the role of herbal supplements in immunity. So I am Dr. Erwin Martinez Faller from the Philippines, and I'm going to discuss on the very important topic nowadays about immunity, how you're going to boost immunity, and of course about herbal supplements. The main objective of these topics that we have, or this presentation that we have, is what to be the role of the healthcare professionals or the pharmacists with regards to herbal supplements, and as a healthcare professional, what to be our advice then to the public in terms of increasing immunity. No, because there are a lot of misconception, fake news with regards to different herbal supplements in the market that they would say boosting the immune system. So I'm going to acknowledge first the organizers, Dr. Irfan, Suleheria, pharmacist, nutritionist, and dietitian, a good friend of mine, who made this poster, which is more handsome than me with this poster, and the Rotary International Lahore South region, and the Phoenix Foundation of Research and Development. Thank you very much for sponsoring this event. And to the participants worldwide that is posted in social media, the Facebook, and also a YouTube account. Welcome to our role of herbal supplements in immunity. And to my friends and colleagues, good afternoon there. And to my university, San Pedro College, and also Bournemouth University as a visiting professor, and also to the Center of Pharmacy Practice and Research and Policy in Asia and Global Health Pharmacy in Asia for allowing me to be here to talk to you about role of herbal supplements in immunity. So I am in the very southern part in the Philippines, wherein you can see that it is in Davao City in Mindanao, where I was born, and I grew up here in Davao City. And of course, this is the very southern part of the region, 2 hours away by flight from the central, which is in Manila. So we're gonna have a tour around first of where is Philippines in the Southeast Asian region. Now, this is my institution, San Pedro College, wherein this is located in the central part in Davao City, and it has two campuses. We have the ULAS campus, and we have also in the central campus in the downtown area, in the Guzman area street. And of course, mostly of our students are in the healthcare profession, which is pharmacy, biology. We have also nursing, medical laboratory sciences, physical therapy, respiratory, and so forth and so on. No? We have also animal laboratory and research hub, which is located in the ULAS campus. And it has a very high-tech and caliber equipment, the Ethos machine that extract with essential oils. That is one of the specialty in San Pedro College for herbal medications. We also gonna discuss today about immune system a little bit because it's very complex to identify one by one with regards to immune system and how we gonna fight with this COVID-19 and the global race in terms of stopping COVID-19 and the natural products that boost immune system and what are our role as a pharmacist and healthcare provider, nutritionists, dietitians, doctors, and other healthcare professional of the role to herbal supplements, and of course to avoid misconceptions and fake news in the public. So we try to orient the public with that. And what's next? What are our initiatives then in the region with regards to herbal supplements? So when I was a student as a pharmacist before, we always tackle about herbal supplements and up to the upgrading when I was in Prince of Songkla University trying to advance with herbal supplements with the scholarship that they have. We always try to tackle about ginger and other herbal supplements that have this boosting immune system. So I'm going to tackle on that in a moment. Now, as we all know that there's a lot in the market that may have a lot of misconceptions about herbal supplements. They in the news and the right side, you can see COVID-19 boosting your immunity with Dalmia Group's herbal capsule, which have their coronavirus herbal supplements. So is it really a treatment, adjuvant, or is it really for coronavirus that will increase the immune system? At the same time, also in the right side, you can see a newspaper where in even Thailand, Laos, and China, even other Southeast Asian country. I even see this one in the Philippines that is marketed, which are not approved by FDA, Food and Drug Administration, on Linwa, and of course with other food supplements from China. No? That some of the country like Thailand and Laos already approved as part of their clinical trial then as herbal supplements for COVID-19. So it's already in the market. There's a lot of things going on, and that's the main thing nowadays. There's a trending now in terms of boosting with immune system. So you can see there's a lot in the market proliferating. So what is all about immunity and what is all about innate and adoptive? So you can see in the slide that we have herbal supplements that are already receiving increasing attention, and it has been more extensively in the disease treatment or promoting health during the last decades. And you can see in the slide that you have innate, meaning that it is a natural, and we have also adaptive, which is also an adapted or acquired immune response. So you can see in this particular slide that This innate immune response involves neutrophils, eosinophils, basophil granulites, mast cells, dendrite cells that actually protect and of course releases inflammatory mediators, no? That actually involves with different sets of immune response in the body for infectious and pathogenic infections. We have also in the right side about adaptive. When we say adaptive, meaning these are acquired then, no? Acquired. So it involves about beta cells, T cells, and of course those which are fighting against viruses and even pathogens then that has this what we call as very, very slow because it takes around days to actually go on with this, protecting against with these pathogens and malignancy transformed cells. No? And if you can see in a particular slide, you can see also that immediately the innate immunity are more into immediate response in comparison with adapted immunity. Now, on the next slide, you can see actually that these are different layers of immune system. What do you mean by different layers of immune system? It actually demonstrates to us that there are different kinds of barriers. No? We have physical and biochemical barriers that combat pathogenic microorganisms that elaborate to us that immune defense system comprising of the physical and biological barriers. We have also immune cells that protect us into the body. We have also antibodies like immunoglobulins, IgA, IgD, E, G, and M that actually protects from different pathogens in the body. So there are also from external factors, different environmental. So we have pollutants and of course innate toxins in some of the foods. Example in the food, we have carotoxins from carrots, persins in avocados, and even glycoalkaloids in potatoes that that actually protect us from these particular toxins from the environment and also from the food. So this particular layers of immune system then recognize specific antigens on the invading microorganisms and form antibodies against it and enable identification then for attack by another immune cells or neutralize the pathogen directly. So in that case, we have all the layers that we have to protect ourselves. How about in case that it will lower in terms of your immune response? Like, for example, for those immunocompromised, like, for example, those geriatric patient and pediatric patient then, and for those who have suffered with HIV, and those we have immunocompromised patients. So in the next slide also, we are trying to look also with micronutrients. No? In the micronutrients, this actually help us also boost the immune system, which will be discussed later on. Example of which like vitamins, minerals that we have, like for example, zinc, that protect us from all these pathogenic microorganisms. Now, for COVID-19, as we all know, it's been declared already by World Health Organization that COVID-19 is a global pandemic. And it's quite similar with SARS and MERS in 79 to 88%. And it is in the category of beta coronavirus. So it is within the human transmission then. And of course, it is also reflective in COVID-19 that there is actually an increase of a level of a serum then of a pro-inflammatory cytokines, the IL-1, IL-6, the IL-12, interferon gamma, IFN gamma, and all those monocyte macrophages that will cause association of the pulmonary inflammation and severe lung damage, particularly for COVID-19 patients. These are actually been observed in the ICU patient wherein there is what we call as cytokine storm. The cytokine storm. So this cytokine storm is actually associated with the pulmonary inflammation and severe lung damage. So you can see that in this particular slide that it is very important to take note the clinical cause, the underlying cause of disease severity with regards to COVID-19 patient. That is why we tackle here right now in terms of what is all about immunity and of course how this herbal supplement then try to boost the immune system. You can see in this particular slide that the airborne SARS COVID-19 CoV-2 infections in humans innate initiate from the virus entering a nasal and airway epithelial cells through binding to angiotensin converting enzyme or ACE2 activating that activates SARS-CoV-2 the spike proteins co-localize it with ACE2 and prime the SARS-CoV-2 fusion directly at the plasma membrane. So at this point, then, it connects with the host, with a particular cell then, and of course, try to infect the type 1 and type 2 alveolar epithelial cells. So in this case, to sum it up, with this presentation, that there will be what we call as a cytokine storm, trying to help increasing this pro-inflammatory cytokines, including with the macrophages, the type 1 IFN, the neutrophils, the plasma cells, and all those innate and of course with adaptive immunity that we have. So in that case, it will really strongly look into the inflammation in the pulmonary and severe lung damage. So you can see in this busy slide that uh, uh, inventors, or shall we say scientists, actually trying to look into the whole details of the mechanism and the signaling pathways in terms of COVID-19. And it's well developing nowadays with regards to tocilizumab, other basitinib, and of course infliximab, and other particular drugs in the market under clinical trials, trying to identify to stop this COVID-19 pandemic that we have. So this is a very complex detail how the SARS-CoV-2 driven signaling pathways that we have and its potential drug targets in the future then for phase 1 clinical trials in the market. So it's very evident COVID-19 pandemic, but scientists actually warns against it. Okay, the lack of coronavirus cure makes it people to run into the herbal supplements, and even the president of the Madagascar, President Andry Rajoelina, even actually endorse this is what we call as herbal cure known as COVID organics or CVO. This is not VCO but CVO, COVID organics, wherein the main component of this CVO or COVID organics are in your Artemisia. Okay, Artemisia. So Artemisia is a well-known particular herbal which is used to treat for malaria. Okay, for malaria. Even you can see in the particular slide that even young actually try to take with this without knowing what will be the side effect. What will be the potential side effect for the kidney and for the liver. So even WHO even declare that they will willing to support international medicine. So it's been a support then. Even in the World Health Organization, they even supported almost in the 14 countries, supporting 89 traditional medicine products by the WHO in terms of meeting international and even national requirements in the registration for this particular. So we already know that the main lesson for COVID-19 is actually putting into the clinical trials what we have adopted for those particular animal study. So moving to this from animal study to a clinical trial would ease us a lot in terms of using for this herbal supplements. Now, even in the Philippines, you can see that virgin coconut oil is moving into the clinical trial against COVID-19. And in the Philippines, in the Philippine General Hospital, it has been adopted to have 3 tablespoons. No? Every meal you have once, and a 3 tablespoons of VCO is been given within 14 days of trials. So we have almost 100 of patients having with this clinical trial in the Philippines. No? And the main mechanism of action really of VCO, according to Professor Dairit, is that when the coconut oil is ingested, an enzyme in the body metabolize the coconut oil and releasing the active compound known as monolaurin. Monolaurin, and of course, another one, we have lauric acid. This monolaurin is used to protect from farm animals and against bacteria and viruses. So they're trying to look at if they can actually use this for human to protect, because they have already a study in the Philippines that they can even protect for HIV for a very minimal patient. No? So it is very evident according to their trials, no, for HIV patients. So they want to move on for COVID-19 also. No? So it's very evident in the Philippines to go with VCO. Now, in Ateneo de Manila University, they posted that there are potential for coconut oil. Now, that was led by Professor Dairit in Ateneo de Manila University for, for this clinical trials. And there are 3 mechanisms of action that was seen for VCO. One of this as an antiviral agent that was seen that they can cause degradation of the virus envelope. That's one of the mechanism of action. Another mechanism of action does not only destroy with a virus envelope, but they can inhibit a late maturation state in the virus replication. And of course, number 3 is that they can prevent the binding of the viral proteins to the host cell membrane. So these are the 3 mechanisms of action that they have seen for an antiviral agent that they have. So aside from its anti-inflammatory action that has been seen by different scientists in the Philippines and worldwide with regards to anti-inflammatory and skin hydration barrier function. In the next slide, you can see that there are a lot of herbal supplements, and one of these herbal supplement is the echinacea. Okay, echinacea, or what you call as purple cone flower. You can see that it is very well known in terms of improving immune function. And according to some authors and scientists, Eggert and of course Bani and Hodgson, they mentioned that the cell resistant to are very resistant to influenza, herpes, HSV, vesicular stomatitis viruses, and it even suppress cytokine levels. And it even stimulate cellular immunity. So that's one of the function of the purple cone flower. So in this case, there are a lot of studies pertaining to echinacea or purple cone flower. So I'm not going to mention one by one, but they have potential. But then to take note that these are only with animal subjects. They are not in the clinical trials with human subjects. So that's one of the downfall with it. But they are safe then for animal studies. Okay, that's one of the highlight then of the echinacea based on animal study. So there are a lot of dosing considerations. We have 5 ml twice a day for 10 days. There are different in terms of dosage and of course strength depending upon what particular product is it. Is it in drops? Is it in a syrup form? It depends. Or it may be in a capsule form. So it has a different dosage considerations. And even if that to be in a cold prevention, there is a particular dosage consideration for it. And we have also safety concerns. So there are a lot of safety concern with it, which is one of the side effects would be in terms of fever, nausea, vomiting, unpleasant taste, and of course, there are sensitivity then for allergic reactions and even possible safety for first trimester for pregnancy. It's quite safe for that without harming the fetus. Even for breastfeeding, there is no sufficient evidences for it. No? But the main highlight for safety concern is all about interaction. So what is all about the interaction? It really have this increased effect and side effect with this particular drug. We have caffeine, lovastatin, estrogen taking up with contraceptives, diltiazem, cyproporine, and of course other drugs. It may also decrease the effect of lopinavir and ritonavir, which is under clinical trial, right, for COVID-19. So we don't want that. They may have a lot of side effect associated because of decreased effect with regards to interaction, drug herbal interaction with it. Another thing with this is another herbal supplement that are common in your kitchen are gingiber officinale or ginger. There are a lot of potential evidences that enhance IgM that links to a stronger antibody response. And they have a lot of effect like platelet aggregation for vomiting, swelling, pain, hypertension, and all. But the main phenolic compound or the bioactive compound that they have that makes this efficacy are your gingerols, the flavonoids that you have, the quercetin, gingerols, no, and other terpenes that make it essential for this particular herbal supplements. It's already available in the market. You can have capsule already for gingiber officinale. And these are a line of different effects, including of which is anti-inflammatory activity of your gingiber. Another thing is that it has a lot of potential mechanisms. I'm not going to go one by one, but it really increased the levels of immune response to certain patients. No? And of course, safety concern are usually more on side effects because some of the people may have heartburn, diarrhea, general stomach distress, no? And the main important with this is for pregnancy. It may have a lot of issues pertaining to the safety for pregnancy. And that is number one is miscarriage. Number two is that it may trigger with a lot of motion sickness without harming your baby. Major malformation, which is only 1 to 3% no, for pregnant women. So for me, as a healthcare provider, I'm not going to give this one ginger for pregnant women because it may have an untoward effect for patient. We don't want it to happen for pregnant women, and especially also for breastfeeding mother. There's no reliable information, so we don't give because we don't. There's no sufficient evidences, particularly with ginger. Now, moving on to this, there are a lot of interactions. It may be nifedipine, warfarin. It may interfere in terms of slowing down blood clotting It may interfere also with a lot of combination with ginger and of course with a lot of drugs. Moving on with the minerals and multivitamins that we have. In the minerals, that is zinc. It has a lot of potential immunomodulatory effects that we have, no? Like, for example, for common colds that are very essential, no? And these are, if you have a zinc deficiency, you can see your body are weakening because your immune response are also weakening. Your innate immunity, like reduction of monocyte, reduction of your protective cells, reduction of your macrophages, no? And of course, adapted cells that are decreasing. All of it are decreasing and impairing maturation because of this deficiency that we have. So it's very essential to maintain on required dietary allowance that we have, because you can see that one in your food, in your daily diet to maintain for zinc. Now, there are a lot of safety concerns that we have. Like, for example, it should not be larger than 40 milligram daily, according to RDA that we have, because if that will be too much, it will have a lot of side effect. It may cause fatigue, stomach pain, it may cause a lot of major problems. And if that will be 100 milligram of supplemental zinc that you may have this potential in terms of developing prostate cancer. So that's one of the side effects then associated with zinc. Now, for safety concerns, there are likely safety concerns for pregnancy and of course likely unsafe when uses with high doses. So we don't give it more than 100 milligrams for that, 40 milligram, because it may have untoward side effect for patient. Now, there are a lot of interactions, especially with antibiotic like cephalexin, penicillamine, antibiotics, and other drugs like your ritonavir, which reduces absorption. It has a lot of decrease, especially with antibiotics. So we don't give it. So as a pharmacist, our counseling with patient that it may be given 2 to 4 hours per patient before a certain antibiotic to be given, okay, with zinc. So there will be interval within zinc and of course with antibiotics. Now, in terms of dosage consideration, there are consideration for recommended dietary allowance. So it depends upon how many milligrams do we have, how many our body surface area, our weight then. So it depends. We need to calculate it based on recommended dietary allowance on the age and of course our weight. No? So in the zinc deficiency, there are also recommended dietary, so we increase on it 2 to 3 times more than the normal dose that is only recommended. Take note, only recommended for those who have zinc deficiency. Now, moving on to the next slide, that we have garlic. Garlic then is actually quite well known in our kitchen. No, they have a major organophosphate, and it has a major component known as allene. And it is being converted when we slice it, when we cut it, when we crush it, then it will be converted to what we call as allicin. No? And it's very essential then for hypertensive patient, but it's also good to boost your immune system. So there's a lot of documents you can see that documented for immune response. I'm not going to go one by one, but then it will actually boost our immune system and of course decreases this inflammatory response in the response to our body. Now, there are a lot of safety concerns with regards to this. We have heartburn, gas, nausea. It's very odorous when you actually have this very fresh garlic that you have. So the problem here is that when you have the fresh garlic, it will go to your stomach. It's very irritating. So it's not recommended then if that to be fresh. You need to have at least try to fry it so that you actually deleted all those particular biochemical that try to have this particular ulcerations, no, in the body, no, certain pH that will decrease. Now, interactions, it's quite very have this interaction with isoniazid, atazanid, because it will reduce absorption, and we don't recommend it for those uh, with other drugs because it may lower blood pressure. It will also have quick liver break in some medications. And for HIV medication, we don't give it because it may have this decreased amount of your HIV medications in the bloodstream. So there are dosage recommendation for that: 300 milligram garlic powder tablet per day. Yeah? So we have another herbal supplements. We have licorice root or Glycyrrhiza glabra, which are very essential then to down-regulate expression of pro-inflammatory cytokines of a tumor necrotic factor alpha, interleukin 1, and interleukin 6. Okay, and it has a lot of essential because it actually increases them with our interleukin 2, interleukin 6, and other interleukins pro-inflammatory in the body. Now, looking at safety concerns that are possibly safe and it's very have the side effect of high blood pressure, low potassium levels. So we don't recommend to go with it with furosemide and other diuretic effects because it may have a lot of side effect associated with it. And one of the side effect is tiredness, absence of menstrual period, headache, and so forth and so on. Now, looking at this for pregnant women, there are some side effects for breastfeeding. It may have side effect, and for heart disease, it may actually have this congestive heart failure to worsen, and a lot more. No, so there are a lot of interaction for warfarin, for digoxin. It may decrease potassium levels, so take note with it. You need to monitor the potassium level. And for furosemide, you'll be able to get rid, it may actually cause in getting rid of this potassium levels in the body. So take note of the potassium level for patient. Now, there are a lot of dosage considerations. So you only give 1 ml of specific product containing licorice. And of course, it has a specific dosage consideration. Now, moving on to the last herbal supplement, we have cat's claw that is available in the market in the capsule or tablet form. We have two particular variety. We have cat's claw Uncaria guanesis and Uncaria tomentosa. So it looks like a claw of a cat. No? That's why it's called as a cat's claw. So there are biochemical compounds like mitraphyline, oncarine, isomitraphyline, uh, terofodilin, and speciophilin, which are very essential as a bioactive compound for immune response. So it has a lot of this biochemical actions, and of course, it has a lot of this immunomodulatory effects that decrease lung inflammation in the body, which are visible and viable then for COVID-19 pandemic, because the main effect is usually lung inflammation. And this is the target that we are looking at for cat's claw, which is decreasing lung inflammation. Now, there are a lot of safety concerns then because of renal failure. We don't want it to happen to our patient. Nausea, vomiting, stomach discomfort, hormonal effects, diarrhea, and one important thing is hepatotoxicity. So we don't want it to happen to our patient. Now, looking at with Changbai mountain walnut, this is available and produced in Changbai mountain in China. And usually they have a very good immune response, no? And immunomodulatory function that induces splenic enlargement, no? And of course, it boosts the immune system. And this is the mechanism then of a walnut proteins that actually looks into the T cell expansion. And voila, you have an increased IgA production, increase of phagocytic activity or action of the macrophages that are helpful in terms of immunomodulatory effects. So we have Vitex segundo or Lagundi or Nergundi, or they call it as a chastity tree, which are very good as an Ayurvedic property, and they're very good as your for cough, fever, no, for inflammation, and specifically this is widely used in the Philippines for asthma. Okay, and of course, an immune stimulating effects in the body. So this is the particular bioactive compounds that inhibit NO production and decreases IL-1 beta and IL-6 in the body. So it has a lot of immunomodulatory effects. And this is a dosage consideration wherein 300 milligram tablet are given to the adult, 2 tablets 3 to 4 times in a day. Okay, because you need to have to the level of this in the blood serum, and it is also available in 600 milligram tablet for adults, 1 tablet 3 to 4 times in a day. So depending if it is a syrup, a tablet, or Lagundex Forte. No? And we have safety concern. It may have a mild rush and itching that was reported 2% for women monitored while they're taking up with Vitex segundo, and it's not recommended for use during pregnancy, okay, which are not well established for lactating women and for pregnant women. And it's already established that it has a lethal dose 50 of 7.58 gram per kilogram body weight. So we have another one, we have tawa-tawa or Euphorbia hirta. These are widely used throughout Asian countries, especially tropical countries. It is also used for asthma, for dengue in the Philippines. And of course, has a very vast bioactive compound for rutin, quercetin, euphorbine, and it has a very good anti-inflammatory effects as a model for forbol acetate-induced ear inflammation in mice. So there are safety concerns. There are no sufficient evidences then, but still the government is still looking at that. They are taken by mouth for nausea and vomiting. And for pregnancy and breastfeeding, they are possibly unsafe that will cause uterus to contract and that will result into miscarriage. And there are also stomach or intestinal problem that irritates the stomach and of course the intestine. So there are dosing considerations for this in terms of health, the wide range of it. So you better consult your pharmacist, physician, nutritionist, dietitian, and other healthcare provider for this if you're taking up with tawa-tawa or your euphorbia or other herbal supplements. So that's usually with herbal supplement. What we actually do in the Philippines because of a lockdown and because of this COVID pandemic crisis, we usually have calls for nationwide free online medical consultation, and we actually accepted a lot of calls pertaining to herbal supplements, and we educate the public that herbal supplements are not actually for the treatment because they have a lot of misconception, fake news that you can have in social media pertaining to herbal supplements. So there are a lot of initiative from the government pertaining to some herbal supplement like VCO, Tawa-Tawa, Lagundi, no, or Nergundi in terms of clinical trial nowadays. No? So we need to be informed, and we have witnessed then in our national or nationwide free online consultation that people are educated. No? We need to be visible then as a healthcare provider for patient pertaining to herbal supplement because we are more educated then, and we need to educate with our patient with regards to the use, the dosage consideration, the safety, that there are a lot of interaction pertaining to herbal supplements. This is been initiated by Association of Medical Doctors, by pharmacists, social workers, nurses, and other healthcare providers. So, and these are our initiatives by other healthcare provider, by nurses, physician, by pharmacists, educating the public with regards to herbal supplements and synthetic medications. This is a nationwide program. There are a lot of people registered here. And of course, this is our services, medical consultation, psychological first aid for mental health, medication review, medication counseling, and herbal supplement counseling. So these are my references, and this is the end of my presentation. And of course, thank you very much. Thank you, Dr. Irfan. Thank you very much to Bournemouth University, to San Pedro, Global Health Pharmacy, and Center for Pharmacy Practice, Research, and Policy in Asia, the Rotary Club International, to Dr. Irfan, and for Phoenix for Research and Development for the sponsorship of this event. And I hope I have contributed to you about the role of the herbal supplements in boosting your immunity. And as a healthcare provider, then how can we actually generate information to the public with regards to misinformation and fake news that are proliferating in the social media and of course other social means. Thank you very much.
Thank you, Dr. Erwin. Very precise and to the point presentation. What are the role of herbal supplements in boosting immunity in this COVID-19 era? So there is a one question. Is there any senna leaves are useful in boosting immunity?
As far as I know, that senna leaves are actually used for laxative, and it has a lot of potential bioactive compounds. No, not only in terms of laxative, but also in other function. But in terms of COVID-19, if I am a scientist, I think one of the side effect then of senna is of its laxative efficacy. So I don't really recommend then for senna to be part of the COVID-19 herbal supplements for clinical trial because it may have a lot of side effect associated with senna. But it can be a potential later on, no? It can potential later on for immunomodulatory efficacy because of its bioactive compounds that we have. That's a very
So
good
it
question.
it means it has a laxative property, not as a immunity boosting properties.
Yes.
There is one question in the audience. What is the procedure of antiviral drug discovery and how one antiviral drug come into the market?
Usually with antiviral agents in the market, still in the developing stage, that are being with the big companies, no, that are led by Northern America, and of course there are also in Asia, particularly in India and other Asian countries that led with this. In terms of antiviral agents, there are a lot of mechanism of action pertaining to these antiviral agents. As what I mentioned a while ago, that it actually decreases with these pro-inflammatory cytokines that are leading to this pulmonary inflammation and severe lung damage. Because our immune system does not anymore recognize which cell to be actually stopped or to be actually eaten or phagocytosis happen. So in that case, with the antiviral development, it's a long process then because it's not a step of a second you have the antiviral agents. No, the vaccines that are developing now are undergoing phase one trials. No? Like for example, with different trials that we have already in the market, like ritonavir, the liponavir, no, and of course other antiviral agents. Uh, Even they maximize with HIV HIV agents that can be used later on as a for COVID-19 pandemic. So it's a long, long process. It may take up months, even years, to develop with this antiviral agents that we have. So we need to go on with the new normal because washing our hands with this social distancing and other means then would be our precautionary measure before we can actually go on develop with this antiviral vaccine vaccine.
Yeah, yes, it takes it. It is a time-taking process. Just because there is a era of COVID-19, people are just telling me, I'm a pharmacist. That you just tell me when the proper medicine came into the market of anti this coronavirus. I said it is a time-taking process. It rather once you sleep in the night and when you wake up in the morning, there is a medicine in the market, just like antiviral drug. Coronavirus is a new virus, it's the RNA virus. And to protect against RNA virus, there is no any drug available to treat this RNA virus. Just like example of HIV. HIV is a RNA virus. So it is a time-taking process. It will take some time. But as you said, some traditional medicines are somewhat effective right now.
And actually, also, if we have the vaccine already, we are trying to look also with the safety concerns to the public, no, if it is safe or not. So there's a lot of clinical trial then, phase one, phase two, post-marketing surveillance, pharmacovigilance pertaining to the safety and efficacy of this COVID-19 vaccines that we have in the market.
Yes, right. And the main objective is to just to enhance the immunity. And to enhance the immunity, it is a long process. It is not in a 2 months or in a 1 month you can enhance properly. It is linked with your lifestyle. If your diet is good, if you are doing physical activity, then immunity will be strong. So in these days, people using junk food. Junk food is the biggest, you can say, factor of this to break the immunity. So thank you, Dr. Erwin, for your precise presentation on a role of herbal supplements in this era. So we have proper of appreciation of e-certificate, which are going to be delivered by you via mail. Just stop your. I'm sharing your e-certificate. This is your certificate for your lecture on role of herbal supplements in immunity booster. It will be received by mail in a couple of days. And thank you again for your time and your patience to deliver such a important hot topic regarding what is the role of herbal supplement in this era. Because you people, I'm a pharmacist and I'm a the nutritionist too. People usually ask me why there is so much delay in the medicine for treating this coronavirus. I answer them. It is not a game of couple of days or just when you wake up in the morning and there is a vaccine in the market. It will time taking process and you have to live with it. Only safe way is the keep your hygiene good. Social distancing is a very important factor. Lockdown is a very important factor to this. These are the only factors on which you can avoid this pandemic disease. So thank you again for your time. See you next time.